Hello Facebook, and excuse the squeaking. My word, that was terrible, wasn't it? So, hello, I am Chris Pickard, and here at Brookman's Park in Body and Balance, I'm here to talk to you today about shoulders and the 4 most common shoulder problems that I see in the clinic. Okay, and that is frozen shoulder, arthritis, rotator cuff injuries, and instability of the shoulder as well. I am going to do a separate video on injuries commonly seen by weightlifters, bodybuilders as well, but that's going to be separate, but there is going to be some overlap here as well. So, wave hello Liz. So, where should we start? Well, we're going to start with the fact that about 67% of the population will at some point have a shoulder problem so severe that it will actually disable them, whether it's just for a few days, or it could be a few weeks, or it could be a few months. Okay, and I'm going to start with number 1, not number 4. I'm going to start with number 1, which is frozen shoulder. Okay, now frozen shoulder is something that I see massively misdiagnosed. I see so many people that have been told by their GP or someone that they've got frozen shoulder just because they can't maybe lift their arm above head height. But that alone is not frozen shoulder. True frozen shoulder goes through a period of certain symptoms, goes through a period of actually stiffening up, then it can become really painful. You can't really put your arm behind your back, you can't really lift it very far at all, and even if someone tries to get hold of it, it doesn't go anywhere. It's like it's actually stuck, even though the person's not resisting at all. And frozen shoulder, if left alone, will get better in anything from 2 to 3 years. But it can cause unbelievable toothache pain every night for a good year of that. There is a way to speed this up. Now, the number 1 way is something called the Niel-Asher technique. A lot of practitioners around the country have been trained by Simeon Niel-Asher. Niel-Asher is his surname. And he's treated a lot of people with his Niel-Asher technique. I've been trained by Niel-Asher to do the Niel-Asher technique as well. And yes, it really massively brings down the amount of time in which to get people better with frozen shoulder. And in fact, it seems to have an effect almost immediately. And it can bring it down from 3 years to 9 months. Now, 9 months still seems like a long time when you've got pain, but 9 months is an awful lot shorter than 3 years. And there's some other things that I do that speed it up. For instance, if you have diabetes, it's even harder to work on frozen shoulder for some reason. But because I also work with diabetes and diabetics to really bring down low blood sugar, I can bring it down to the same as if you didn't have diabetes, if you follow my advice. So frozen shoulder, the first thing is the Niel-Asher technique. But there is a miracle in store as well, because I once saw a lady with frozen shoulder, and it did seem to be frozen shoulder, and I used a technique called Cranial Laser Reflex Technique. And we got her from here to moving her arm fully in about 10 minutes. It's completely safe, no side effects whatsoever. It's one of the first things I now try on everybody with frozen shoulder, just to see if actually it's suffering from a lack of light. Yes, unbelievably crazy, I know, but some muscle chronic problems are just a lack of light entering the brain, basically. So it can be very easy to fix sometimes. So that's frozen shoulder. The next thing is rotator cuff injuries. Now, the rotator cuff are 4 muscles that go into the shoulder. I'm not going to go into the anatomy of it. You either know it or you don't. And when I stick this YouTube video up on YouTube, I'll then stick it on my page as well. And I'll have lots of other videos going into all the in-depth stuff. But basically, there are 4 muscles that hold the shoulder in the socket. But very often, people's slumped posture means that these muscles are now having to do things that they weren't meant to do. So, for instance, if I slump, I can't bring my arm back like this, but if I'm upright, whoa, Look at all that extra shoulder motion I have. And so because people are trying to move their shoulders in this slump position, it's one of the most common causes of rotator cuff injuries. And I'm going to quickly show you an exercise in a moment. So rotator cuff injuries, you've got the posture, and then you've got to do the right exercises. Then you've got to use things like laser therapy, ultrasound therapy. You've got to work on the underlying causes why it might not be getting better, like nutrition. If you watched last week's video, you'll know that nutrition plays a huge role into why some people don't get better. And rest, and ice, and all these other things. But very often the big one is just poor posture. So you want some postural exercises to try and stop the recurrence and also to fix it as well. Next thing, instability. Now, instability comes in two different forms mainly. One is the fact that the muscles are just out of balance and too weak. And very often it's instability because of poor posture. And you need to do exactly the same thing for instability as you do to prevent rotator cuff injuries. So I'll show you that in a moment. Second major form of instability is where the ligaments themselves are either broken or too lax. And the ligaments are what actually hold the joints together and then they limit the motion. Now, if the ligaments are too lax or they're broken, well, if they're broken, you need surgery. If they're too lax, you can have injections of certain things that stiffen them up. Sometimes certain nutrients can actually help stiffen ligaments and some kind of immobilization therapy. But also, if you strengthen the stabilizing muscles, which is the rotator cuff muscles, again, then you can decrease instability, even if it's from the ligaments. So here's a little exercise I learned from one of my favourite YouTubers, a guy called Jeff Cavaliere of Athlean, or Jeff Cavaliere of athleanx.com. He's got loads of great videos. When I put this on my page, I'll have a link to his video underneath it because, okay, there are lots of great exercises for stability of the shoulders, but this is a really good little one and it's just a one-off exercise and I'll just quickly show it to you. What you need to do, I know you can hear me because I've still got the microphone, is you need to lean against a wall, okay, and you bring your arms out and now you're going to hear the weights thunk. So the weights are against the wall, my elbows stay against the wall, and then keeping my elbows against the wall, I lift the weights up and I'm, there you go, trying to push them against the wall, but I'm trying to keep my back upright. And I'm just doing this, so I'm doing a biceps curl, but I'm doing it so I'm coming back like that, but I'm doing it against the wall with good posture. And it's a great exercise for your biceps, but it's great for getting all the postural muscles, and it's one single exercise you can do and it's fantastic. So, what have I covered so far? Frozen shoulders, I've covered impingements, not impingements, instability, rotator cuff injuries, frozen shoulder. But then there's also finally arthritis. And my notes are just slowly sinking again. Arthritis again has many causes. If you watch any of my past videos on arthritis, you'll know that it can be due to the food you eat, it can do with the way the muscles are imbalanced, and it's the same with shoulder arthritis. Very often, again, it's because of chronic poor posture, putting chronic strain on the rotator cuff muscles. They can't hold the shoulder in the socket properly, so the shoulder gets uneven wear and tear and becomes arthritic and painful. But a lot of shoulder arthritis is only painful because the foods you're eating or not eating and the toxins that are going in the body that aren't getting out is causing extra inflammation. Or it can be you're eating too much sugar, which causes inflammation, or the wrong kinds of fats, which can cause inflammation. So with arthritis, again, you've got to look at your posture, get the posture fixed, rebalance the muscles, and look at your diet and nutrition and do things that can actually fix the joints from the inside. And we know this is so true. We know that so many things can actually cause arthritis that it's to do with what you're eating because, well, for one thing, what do doctors do to change pain in arthritis? They give you a pill. It's something you take and ingest inside your body that affects things. Also, experimentally, arthritis is caused in animals by injecting a chemical that causes all the same problems that arthritis does. So it's pretty massive likelihood that painful osteoarthritis in humans is actually caused more by what we eat and what we don't eat more than wear and tear itself, because there are plenty of people with lots of wear and tear and no pain at all. So arthritis by itself is not the cause of the pain, it's one of the symptoms of underlying problems. I hope that's all been really useful for you today. So I have a little offer. So if you're watching this and it is still July 2018 and you have a shoulder problem and you're somewhere near us in Hertfordshire or North London and you would like some help for free, just pick up the phone, call 01707 662 704 and just say, Facebook shoulder, free consultation please. And I'll book you in for a 15-minute check to see if I think there's a problem that I can help with. You're of course more than welcome to book in for a full consultation and let me help you straight away. But if you just want to come in, you're not sure about us, you want to check us out, Facebook free. Or if it's still July 2018 and you're watching this on YouTube, then don't say Facebook shoulder, say YouTube shoulder, free consultation please. But this is only valid for July 2018 because this is the month I'm talking about sports injuries and energy and athletic performance. Thank you once again for watching. Live long and posture. And if you're on my email list already, look out for the email where I've got lots of videos all about shoulder rehab. Be well.